Welcome to video 17. Have you ever had one of those patients where their dizziness just doesn't seem to make sense? All the peripheral tests come back normal, but they're still struggling. Well, the answer probably isn't in the inner ear. It's higher up in the incredibly complex networks of the cortex. So let's dive into how the brain actively builds our entire sense of space. So let's paint a picture that I'm sure is pretty familiar to a lot of you. You have a patient who comes in reporting this debilitating visual dizziness, this real spatial disorientation. Maybe it happens when they're scrolling on their phone or walking through a crowded supermarket. So you do the right thing, you run the tests, VHIT, CalRX, the whole shebang, and everything comes back clean. Their peripheral system looks totally intact. So what on earth is going on?
Well, the answer isn't hiding in the usual spots. It's not in the labyrinth, it's not in the brainstem reflexes. To crack this case, we have to move our investigation upstream, right into the cortical networks, where our actual perception of space and self-motion is put together.
And at the absolute heart of this whole process, we find a core hub, the parieto-insular vestibular cortex, or as we call it, the PIVC. Honestly, the best way to think about the PIVC is like the brain's super advanced GPS fusion engine. It's not just sitting there passively getting vestibular data. No, it's actively pulling together all these different information streams to create one coherent map of your movement in the world.
The real power of the PVC is just how multisensorious it is. I mean, look at all the data it's pulling in. Sure, it gets the raw vestibular input, but then it fuses that with visual motion, with sensations from the body, with information about neck position, and even something called a motor efference copy, which is basically a blueprint of the movements you intend to make. It's a true integration center.
Okay, so here's the real breakthrough, the big shift in thinking that helps us understand these complex dizziness cases. We have to stop thinking about the cortex as just a passive receiver of signals. Instead, we have to appreciate that the PIVC and its network are actively constructing our stable perception of the world from all these raw ingredients.
And the way it pulls this off is through a critical computation called a reference frame transformation. So, what does that actually mean? It's the brain's process for taking raw head-centered data, like my head is turning to the left, and converting it into a stable, world-centered perception, like I am turning my head to look at a bookshelf that is staying still. It's what allows us to separate our own motion from motion out in the world. Absolutely crucial.
And this isn't a one-shot deal. It's an active cascade. The brain grabs that initial head-centered vestibular signal, it integrates it with data from the body and eyes, it computes these vital intermediate reference frames, and only then does it generate a final, solid estimate of your body's motion in a stable world. You see? It's not a simple reflex. It's a really sophisticated calculation.
So what happens when this complex, beautiful fusion engine starts to malfunction? What if the system starts giving way too much weight to one input over another? Say, for example, it becomes excessively reliant on visual motion cues. Well, this is where that confusing clinical picture suddenly starts to make perfect sense.
You know, the patient's own words become our most powerful diagnostic clue. With a peripheral VOR failure, they describe oscillopsia. They'll say something like, the world blurs or jumps when I move my head. But with a cortical reference frame failure, the complaint is so much more profound, it's perceptual. They'll say, I'm in a busy place and I honestly can't tell if I'm moving or if everything else is. That right there, that's the signature of a cortical problem.
This failure in the brain's calculations shows up in several distinct clinical conditions. It's the very basis for visually induced dizziness, where just seeing motion creates the illusion that you yourself are moving. It's a huge contributor to PPPD, persistent postural perceptual dizziness, which is all about that chronic sensory mismatch. And of course, it can lead to that deep, unsettling spatial disorientation. It's also really interesting to note the right hemisphere's dominance here. Right-sided lesions can cause some very strange, almost neglect-like vestibular symptoms.
And just like that, this cortical perspective solves our initial mystery. The patient with normal tests isn't such a puzzle anymore. We now have a clear neurophysiological framework to understand their symptoms and a powerful new clue to guide our diagnosis.
So here it is, the key clinical takeaway, the teaching pearl. When a patient tells you they get dizzy from scrolling their phone or walking through a busy store, and their peripheral tests are normal, your number one hypothesis should be cortical vestibular dysfunction. This is not just in their head or anxiety, it's a real network problem with a clear physiological basis.
We can actually break this down into a super simple but really effective diagnostic model. You've got finding number 1, normal peripheral tests. You pair that with finding number 2, those classic cortical type symptoms like visual motion intolerance or that spatial confusion.
You put those two together, and your leading diagnosis should be a dysfunction in this cortical vestibular network.
So let's just quickly recap the main points. First, remember that cortical vestibular processing is an active, multisensory transformation. It is not a passive relay. Second, the brain actively builds a stable worldview using these reference frames. And finally, when that system starts to rely too heavily on vision, it can absolutely cause dizziness, even when all the peripheral tests are perfectly normal.
So, please join me in video 18. We're going to discover how angular velocity actually feeds an internal compass in our brain and drives spatial mapping. And we'll see why vestibular dysfunction can mess with our ability to navigate, even when all the reflex tests look fine. Thank you so much for watching. To explore more on dizziness, vertigo, and imbalance, and to get access to some great resources for both clinicians and patients, please visit AustralianDizzinessClinics.com. And of course, please subscribe and leave a rating.